Hi, everybody. So, things have been a little delayed, kind of a day or two lag on some of my videos just because other things have come up and it's been really exhausting lately. I've been making a lot of progress with my function, but I'm still paying the price, I think, in terms of just needing time and being very drained physically from the recovery and also trying to readjust to being a little bit more productive elsewhere in my life. It's still a bit of a production, getting around, doing errands, all of that. I'm getting back into it, but it's not, I'm not there yet, not normal yet. But today, and when I say today, I really mean what was yesterday for me as I say this, because I'm recording this on day 14, but we're talking about day 13 stuff. So for day 13, it was really good. I got my stitches taken out. So I just have steri-strips on there now, so stay tuned for that. And I also get to have a meeting with Dr. Matthew Crozier, my surgeon, for this procedure. And he spends a few minutes talking through what my procedure was like. And it seems everything went really smoothly. He seems to like what he sees, I hope. And so everything's looking good. Of course, I would always like things to move along faster, but objectively it seems that the recovery is going really well. And so if you'd be interested in hearing my surgeon talk about my procedure for a few minutes, stay tuned. I'm going to tack that right onto this. And also, if you want to see the actual stitch removal and the replacement of the steri-strips, new ones, and the rewrapping, then I'm going to have footage of that as well. It's not particularly gruesome. That might be a relief to some people. That might be a disappointment to some people. But you'll have that. So I got a few minutes for each of those clips. So yeah, things are going well. And finally, after all of that, I actually later on managed to get to the gym for the first time since my surgery. I was not doing any leg stuff. It was upper body stuff, but it was just good. It felt really good just to get back in and do some lifting, do some, just do something. And I'm sore from it now. Because again, that was actually yesterday. I'm recording this on day 14. Anyway, I got a couple clips of that. That you can check out. I'll put those right at the end. But thanks for watching. And I will update for day 14, which was actually today as I record this. I had my 2 weeks post-op physical therapy, my third physical therapy appointment. And things are still going well, but I'll update you on that in the subsequent video. So again, thanks for watching. Stay tuned for the clip from my surgeon and then the clip of the suture removal and the redressing. So take care. My perspective on this whole thing has been that I'm not, I don't have much to complain about. I
Great,
feel like everything's
great.
been going pretty smoothly.
Good, yeah. Well, let's kind of get some of these off the.
This is going to feel nice and comfortable.
Yeah.
Woo!
So got a little blister there. It's nothing to worry about.
Yeah.
Good, but everything, yeah, you're healing that thing up beautifully. Look at that.
Woo.
Good.
Groovy.
So what we do is we just put one in the middle, and then we'll cut them and pull them out both ends.
Cool.
And then you got these right here, and we'll cut those out too. So
Sweet.
good. So what questions do you have for me?
Really, well, I'm sure you do a lot of these procedures. Was there anything eventful about mine when it went down?
I mean, you were a very straightforward knee. Harvest that patella tendon.
Yeah.
And everything went great there. Got it without a fracture or anything like that.
Fantastic.
This is here's kind of what we did at the time of surgery. So, go over all. Did I give you a copy of these?
I got the pictures, yeah,
Okay,
but getting the narrative to go with them is
Gotcha. Yeah. So
awesome.
this is kind of what we saw kind of when we first went in your knee. This is something called an empty wall sign. So that's where you should have your ACL right there. It should be coming, but right now you can see just blank wall right there, so nothing really there.
Gotcha.
Then part of the process is we have a look around the rest of the knee to make sure there's no other underlying pathology and everything look good there. And it's just kind of looking in different parts of your knee. Couldn't find any loose bodies, no cartilage damage or anything like that. So
Fantastic.
this is something called the notchplasty. So what we do is we basically open up the notch a little bit where the previous ACL was. That way we're able to put your new ACL in, and this is what it looks like.
Cool.
So that's what it looks like right there. There's your patella tendon kind of going in there. No impingement right there. Good isometric through range of motion, and everything looks really good. So I was really happy with the result.
Yeah, I've like I said, as far as the pain that I was feeling the days coming after, I was popping pain pills for a few days, and I've been off of them for like a week.
Good. Perfect.
More than a week actually.
Gotcha.
Now, but
So,
everything's good.
Yeah, a little numbness in this area is gonna be normal, just because of the way your nerve endings innervate.
Yeah, and I felt a little bit over here. Like this is probably the most numb area right now.
Yeah.
But yeah, there's been a little bit over there. The big thing is just trying to keep moving it so the swelling's going down now, because I know that when there's a lot of swelling in there, it kind of feels like it's pushing apart my tibia and my femur.
Yeah, for sure.
Which then makes it feel less stable, of course.
Gotcha.
And all that.
So, but good. No, I mean everything. I like to see at this point to review again kind of what happened at the time of surgery. And yours was, no offense, pretty boring, but but
that's what I wanted. That's what I wanted.
I like to make sure we're not having any setbacks in terms of neurovascular damage or wound complications, and this all looks pristine. So what I'll do is I'll have the guys come get your stitches out, and then I want to see you back here in another month. What I'm going to look for at that point is range of motion should be pretty good at that point. Yeah. I'm okay if it's not 100%, but range of motion should be on its way. The quad may or may not be waking up at that time.
And in PT, they got me now. I can do straight leg raises with it.
Perfect.
She got me to 90 degrees of flexion. I had more in the tank for that, but she stopped me there for now. Yeah. Obviously, I can sit here pretty comfortably. I don't have the same amount of extension that I have in this one. I can actually go a little past 180 or past zero, however you want to look at it.
Fix these, so as you can see right here, I can passively get you there.
Yeah.
And when I fix, my technique is I fix you in hyperextension because I feel like it gives a better graft. So, I think you should be able to get that back. So.
Yeah, I'm not too worried about it. I mean, given how much things have improved over the last, we're 13 days post-op.
Yeah, so you're doing, everything's looking good. So
fantastic.
Obviously, you have my number if anything comes up. Boys will get your stitches out, and we'll see you in a month. Okay.
That's fantastic.
All right, good to see you. All right.
Likewise, Doc. Thank you so much.
All right. Am I on some sort of blog somewhere? Or?
Well, yeah, I have a little very tiny YouTube channel where I was doing martial arts stuff and other, for like my judo and a few other things. And I was like, well, why not document this? I can't do those, so I might as well. And I have a bunch of friends who are really curious. I've got friends in the healthcare industry, people who are going into PT, just like a variety. And they're like, I would like to see you as a case study. I'm like, oh, I don't mind.
Perfect. Yeah, that's great. No, I'm all about that stuff. So
good stuff.
Yeah, what's your channel called?
It's literally just Judo Jeff.
Judo Jeff.
GEOFF.
Yeah. All right, I'll see you. All right,
thanks.
Right.
Thanks, Doc.
Going first here, okay?
All right, cool.
We'll get this little guy over here first.
Yeah.
Try to make sure we get that all. Okay, there's the little guy there.
Oh.
He's out of there.
Well, that was just excruciating.
Oh, yeah, it was horrible, right?
Oh, it was terrible.
It's right here. We'll cut right down to there.
Mm-hmm.
We're going to pull here.
Mm-hmm.
There's one.
Uh-huh.
And then going down this way.
Whee!
And there's the other. So, we're good.
It's almost like they're designed to go in and out smoothly.
Yeah, well, that's what you're hoping for.
Right? Yeah. So that was another reason why I was like hoping that the site looked good and that there wasn't like a whole bunch of crud kind of gumming it up.
Nah. Now what we'll do is we'll put some little steri-strips. Now these things can get wet, okay? Mm-hmm. Do not replace them when they fall off, all right?
Yeah.
It's not that big of a deal.
Yeah.
You don't have to go crazy or anything. Go try to find some.
Ooh. That little blister popped.
Yeah.
Cool.
Yeah.
Nice little explosion there. I'm sure somebody I show this to is going to get a kick out of that.
Well, that's all that matters, right?
Hey, man.
That is all that matters.
Gotta give the people what they want.
Exactly. Give them an action film, right?
Fantastic. Yeah.
All right.
This is good. This is good. Ooh. I'm gonna let this.
We'll give you one more on that other side over there.
Okay, cool. Yeah, yeah.
We're good to go.
Sweet. So, does this mean I'm clear to go back into the shower now?
You can take a shower. I would not soak this.
Okay.
I would wait a little bit. Definitely
Okay.
Stay out of hot tubs, pools, things like that.
Yeah, I mean, and at this point, it's become easier and easier to keep it like elevated and like move it around as I need to and all.
When the skin starts to look normal,
yeah,
that's what I tell patients. You can start kind of soaking it.
Gotcha.
Okay.
Yeah.
All right, my man. Our part's over with. If you want to continue with the A-strap, you can. really up to you. A lot of patients kind of go with that.
Yeah. Well, there's something to be said, I guess, for the sense of that little extra bit of pressure or tightness around it that helps.
Whatever, you know.
Yeah.
So what we do is just take this, bring the leg on over. Whoops, watch that. Hold on a second. I'm gonna get that on you.
Yeah.
But you can just kind of
Yeah.
nice and snug. That's it. It also patients seem to like it with the brace too. So.
Mm-hmm. I can weight bear without it. I can actually walk around bare. Though my PT was fussing at me yesterday about that.
Well,
She's like, even if you can, just because you slip or you have a little mishap, it gives you a little external fixation.
Things. It's unforeseen things. Sorry,
Exactly.
It's just alcohol. Okay.
Oh, yeah, that's fine.
Just want to clean that up.
Yeah.
Fast.
And I'm totally okay with that. That doesn't bother me.
All right.
Just but it's good to know that I can tolerate stuff. My PT's going well. That whole apparatus there. Yeah, I can. You want to do the arms?
Yeah. That works for you.
Yeah.
I'll try to
I'm just glad I can do the straight leg raise here and hold it. So.
get down out of here.
Yeah.
Just trying to fight with everything, with our surroundings here.
Right.
So
It's
it's all about fighting with the surroundings when you're doing this brace.
Oh, for sure. It's a great help. It's great to have.
Yeah.
But at the same time, it's like, whew.
It's cumbersome.
Yeah, it is cumbersome.
Very big pain.
And one of the most annoying things is a couple times when I put it on and I didn't line up the joint right.
Yeah.
And then it's like, why does it feel stiff? Oh, well, it's not actually lined up with my knee.
Yeah, you don't have it all set up right.
Yeah, it's a
It
big,
fits.
it's a pain.
It's nice and snug. You don't have to go cranking this thing down, you know. All right, I want you to...
Yeah, for sure. And I have been, kind of modulating the tightness on these middle two because of,
The pressure?
yeah, my fib head has been kind of
Sore right
kind of
there?
sore. Yeah,
Okay.
actually, I meant to ask the doctor about that. I forgot about it.
It's-
But I figured it's a normal thing. It's not excruciating.
Someone's been digging around in your leg.
Yeah.
So I would expect you to have a little bit of discomfort around
Just kind of
there.
fishing around.
Adjust it accordingly, though, okay?
Oh, of course.
Not a no pain, no gain situation.
Absolutely.
You're free to go, man.
Wonderful.
If it works, okay? Let me get you your checkout sheet. You can go ahead and go to checkout and
Yeah.
bring it in here. I didn't, but I'll bring it up there to the front desk for you, okay?
Fantastic. Thank you so much, sir. All right. And there we are. I don't need a crutch, but I'm going to take it with me. So I figured I would just toss in a couple of quick clips so you can see how I'm trying to navigate my way around the gym here. This was my first time back at the gym doing any kind of weight training or anything like that since prior to the surgery, since maybe 3 or 4 days before the surgery, I believe. So it's been a couple of weeks at this point. I'm just mobile enough now that I can get around the gym. I can get around in public. You see on the side of the machine I have my crutch leaning up against it. I apologize for the off-center sort of nature of the video. It's just there was something I could put my phone on, but it wasn't centered, and I didn't exactly... I couldn't safely move the thing that I put my phone on, so this is the best I could do. Definitely not my best work in terms of the amount of weight I'm moving or how it's feeling, but it was good just to get some kind of a challenge in and feel a little bit more physically productive, I guess. So there it is. And I'm also doing this voiceover because I didn't want copyrighted music in the background to be kicking in. But there you go. And you get a little bonus pec pop here because I'm silly. And here's another one. Again, blocking out the music in the background just for safety's sake. This was a tricky challenge, just kind of slinging or swinging my leg over to get here. I wasn't sure if I could handle this because obviously you need a certain amount of stability through your legs just to kind of hold your body in place as you're pulling the weight, and definitely tricky. So I wasn't going as heavy here. Should make sense as to why. So I was really doing just weight that I could do almost a low back extension with without too much difficulty there. The angle is not ideal. I wish I could capture a little bit more of my body there. You can see that the back of my shoulders kind of ending up out of the frame. But again, here we are. As with the previous clip, not by highest weight or the heaviest load or anything like that, but it's something. Just getting back in the gym, it feels pretty good. And yeah, I'm a big fan of back day. I love doing rows and pull downs. I'm a big fan of that. But you can see that half the workout here is just adjusting to sitting and getting myself in and out of whatever position I need to be in for the for the exercise itself, and kind of strategize here. Actually, it ended up being easier. I did a few sets of each of these exercises, switching legs and actually leading with the other leg, but I didn't find that out until the next set. Anyway, thanks for checking that out.